Before understanding about the different layers of the scalp, let's try to understand the extent of scalp. Now, if you see this picture, this is anterior part, this is posterior part, and now anteriorly the scalp is attached to the superciliary arch. This is the superciliary arch, which is a like a margin above the orbit. Now, posteriorly it is attached to the superior nuchal line and external occipital protuberance. Now, usually on the occipital bone there are three lines, usually, that is highest nuchal line, this is the superior nuchal line, and inferior nuchal line. Now the scalp is attached to the superior nuchal line, and at the center, this is like the superior nuchal line is present at the posterolateral aspect. So external occipital protuberance is like the central aspect of it, right? So that is what the external occipital protuberance is. So anteriorly the superciliary arch, posteriorly the supernuchal line, and the external occipital protuberance. On each sides, anterior posterior is finished, right? Now on each sides the scalp is attached to the superior temporal line, right? Superior temporal line, which is you can find it on the temporal bone, right? Now we have known about the extent of scalp. Let's try to understand about the layers of the scalp, main important topic of this video. Now there are 5 layers of scalp, which you can remember it with the name itself, the SCALP, right? Where the S is nothing but the skin, C is nothing but the connective tissue, A is nothing but the aponeurotic layer, which is also called as galea aponeurotica, and or epicranial aponeurosis. Now these starting 3 layers, right, skin, connective tissue, and aponeurotic layer, these are called as surgical layers of scalp. Why these are called as surgical layers of scalp? Because these 3 layers are pretty much attached with each other and they cannot be separated, right? That's why they are called the surgical layers of the scalp. Whereas after these 3 layers, the superficial 3 layers, then we get into a space which is filled with the uh, loose areolar connective tissue. That layer is also called as loose areolar connective tissue layer, or subgaleal space, or subaponeurotic space. I think so you can understand the name itself, the subgaleal space. We have seen the third layer, it is galea aponeurotica, right? Now it is below this, the loose areolar is below that aponeurotica, so subaponeurotic space and subgaleal space. That's clear. Now the fifth and last layer is the pericranium, which is over the skull table. You can clearly see over here, this is the skull bone, above that is the pericranium. Okay, now let's get into somewhat deeper a deeper aspect of it. Now let's talk about each layer. First thing is the skin, right? Now skin is pretty simple over here. It is normal, it doesn't have any exception is that there are a lot of hair follicles in the skin over here, and there are sweat glands, normal sebaceous glands. Important clinical aspect over here is that sebaceous cysts. Now the skin of the scalp has a lot of sebaceous glands, and the ducts of that sebaceous glands are more prone to infections, so there are more possibilities of sebaceous cysts occurring in the scalp. Now the second layer is the connective tissue layer. Now keep an eye on this thing, because connective tissue layer, the second layer and the fourth layer, which is the loose connective tissue, loose areal connective tissue, because the second layer, the connective tissue layer, it is dense connective tissue layer, whereas the fourth one, which is loose areolar connective tissue layer, just difference, try to understand that difference. Now the second layer, the dense connective tissue layer, it has arteries, the superficial vessels of the scalp, arteries and veins, and the nerves of the scalp, right? Pretty simple. Now that's why like this layer, the connective tissue layer, has a lot of vessels and nerves, right? So whenever there is damage, superficial damage to scalp, there is profuse bleeding in this layer, right? The vessels are cut open, which are present in this layer only, right? Now the third layer, it is the aponeurotic layer, which has now what is aponeurosis actually? Aponeurosis is nothing but it is a thin and flat tendinous sheet like thing, which here in this case connects two muscles. The occipitofrontalis muscle, that is nothing but it has two muscles, one part is occipital part, another part is frontal part, right? The frontalis muscle and the occipitalis muscle. Now this part, if you see this diagram, this is a superior view, this is the frontalis muscle, and this is the occipitalis muscle. Now this flat sheet connecting these both muscles is called the aponeurotic sheet, right? pretty clear about this layer, and which is the two muscles stretch, the frontalis and occipitalis stretch, and they maintain the tension of this aponeurotic layer. Now let's get into the very important layer. Now, yeah, I forgot to show about this diagram over here. You can also see over here, this is the frontalis muscle. It is an anterior view and a posterior view. Frontalis muscle, which very important thing over here is that on the frontal bone also, it doesn't have any bony attachments. The frontalis muscle, it directly gets attached to the eyelids. Okay, the occipitalis muscle, you can see over here, it gets attached to the superior nuchal line. Now here you can clearly see the superior nuchal lines, right? This is the external occipital protuberance. Occipitalis muscle gets attached to this superior nuchal line. Pretty simple. Now very important layer, the loose connective tissue layer, or the loose areolar connective tissue layer, right? Now what is its importance, why it is so much important? Very clinically relevant point over here is that it is also called as a dangerous layer of the scalp. Now why it is called as a dangerous layer of the scalp? Now I'll explain you in this diagram. See, you can clearly see over here, this layer is a loose areolar connective tissue layer. Now this connective tissue layer, it is a sort of a space filled with the connective tissue. It is dangerous layer of scalp because the infections usually occur in this layer only, right? Usually infections occur over this layer. But what happens due to those infections? Very important thing is that you can clearly see over here, there is a vein passing through this layer, that is called the emissary vein, right? Whenever infections occur in this layer, the emissary veins also get infected, and those infections may pass through these emissary veins into the diploic veins. These are diploic veins which are present in the diploe of the skull cap. Now this is the skull bone, right? This is the skull bone, this is the diploe of the skull bone. Now the veins in the diploic are called the diploic veins. From this emissary veins, the infections from the loose connective tissue layer can get into this diploe veins. Now this very important thing over here is that this infection in the diploe veins, right? Infection in the diploe veins may cause, very important thing, osteomyelitis, right? Osteomyelitis in the skull cap. Now further, this infection from here, it may pass into the intracranial dural venous sinuses. These are dural venous sinuses. The infection may pass through here, and it may cause venous thrombosis. Venous thrombosis is nothing but some similar to clot formation, right? Pretty simple, osteomyelitis and venous thrombosis. So that's why it is called a dangerous layer of the scalp, because the infections over here may get through the skull cap, and it may cause venous thrombosis, and it may cause osteomyelitis in the skull cap also. Now it is here I have written another thing called safety valve hematoma. Now it can also act as a safety valve. How it can act? Here, look at this diagram. Now you can clearly see over here, this is the skull cap, this and this is the skull cap, and this pink color one is the dura mater, and this red color one is a hemorrhage over here, intracranial. That's nothing but it is inside the skull cap, and intracranial hemorrhage, right? Hemorrhage. And now here, this is the space, that is the loose connective tissue layer. This is the space over that, right? Now very important thing over here, this layer acts as a safety valve. How it acts as a safety valve? Whenever there is an injury, right? Whenever there is an injury or there is intracranial fractures over here like this, I'll put it nicely. Oh yeah, there is a fracture over here, right? Intracranial fracture, and the blood from here, the blood in the intracranial hemorrhage from here may travel to this loose connective tissue layer, right? May travel to this loose connective tissue layer. So the pressure on the brain further decreases, because see, before it was like this is the skull cap, and this was the intracranial hemorrhage, and the brain was pretty much compressed due to that hemorrhage, right? Now due to this fracture, what happened? The blood got it got a safety way, right, to get into the space, right? This space, that is loose connective tissue layer, right? It migrated to that space. So now the pressure on the brain is somewhat less compared to that initial pressure, right? So that's why this space, the loose connective tissue layer, acts as a safety valve in this manner. Now let's talk about the fifth and the final layer, that is a periosteum. Periosteum is quite similar. Periosteum, sorry, this is not periosteum, actually its name is pericranium. So it is quite similar to periosteum of bones. It is covering the skull bone, the cranial bone, so it is called pericranium. And now very interesting point about this is that it is only attached only at the sutures. Now you can see, if this is the frontal bone, if this is the frontal bone, this is the frontal, this is these are the two parietal bones. The one from we are seeing from the lateral view, right? So this is the parietal bone, this is the frontal bone. Now the if you can see over here, this is the pericranium, which is free over all these area, it is free, but at the sutural point it is attached to the sutures, and again over here it is free, right? That's what this statement means, right? It is attached only at the sutures, whereas all the other parts it is free. You can separate out the pericranium from the skull cap. Only at the points of sutures you cannot separate the pericranium. Now this is all about the layers of the scalp and some sort of clinical anatomy associated with it. So if you like the video and like my explanation, then just press that like button, and you can subscribe to my channel. I'll be uploading a lot more videos, and yeah, that's it. It's I tried to make it very concise. So let's meet with another video. Till then, bye bye.